Good morning. Um, so you guys very good on time. In a, I can tell you one story that I did my training at LA, and over there everybody is so in a chase on time. This and even if you come 2 minutes late, your division chief or something, they look at you that it means hey you're late. You know that. So with that mentality, when I start working as a junior faculty, I went to Texas. So and then I was eight like a eight become 8 4 8 10 and it's still like 1 or 2 they show up and I said here when you said eight is not doesn't mean eight. They said it's Texas, eight means 8 10. But I'm very surprised here when I come like even before I see some of you guys here very impressive. So today I'll talk about the water consumption and kidney. During this talk, is it just I'm gonna a little bit challenge the um, way that I mean, you guys think about this. It doesn't mean that I'm just trying to convince you guys that drink more water or not drink water. So these are the one that I'm gonna just put the seed on your brain about the critical thinking that whatever that you hear, always ask why. If in the future in your floor in the ward they ask you you should do this, you said why? And if they said give um, a liter of the fluid, just said why 1 liter, why not 2 liters, why not half a liter? So those are the one that I like you guys. While you're a student, is good to ask. When you become resident or started working, you get shy. You may not ask and like a machine and do the same thing. So this is the one that I'm gonna today, while we go through the physiology of the kidney that we had yesterday with the team that in that small group, we review that one. But I'm gonna just make it a little bit um, some the way that think more. So this one is a one question. It was supposed to be interactive, but I just changed it to the like a one question that how much water we should drink every day. Probably I shouldn't ask you. That's here. And you guys see this one that sorry I can't see right now. No, I know 64 ounce, but it's a showed a lot of encouragement, like to have the what he says. Don't quit now means come on, even if you're not thirsty, continue. You're all the way, okay, come on, you're halfway done, keep it up. Just encourage that just is like a task. You should drink this one to give you the prize or reward. Um, she has half her opinion. I mean, it's not so serious. And the other one has nothing. I mean, just, three different opinion in a one row that how much we should drink, nothing, this, or this is a half a gallon, right? Okay. So based on this one, who just raise hand, who thinks that we should drink 1 liter? Okay. So the first day that I had about the urine, I mentioned we have average and normal people, they make 1 liter urine and we drink 1 liter. This is the based on like a bell shape people. I mean, not these days in US, but the time that I was trained, people drink 1 liter urine and pee 1 liter, right? So who thinks 2 liters? Two. Who thinks half a gallon? Just half a gallon, half a gallon. And then who thinks that it depends on thirst? Okay, so seems widely distributed. So we're gonna talk. These days, everybody goes for the Dr. Google to figure out how much we should use. I want to just make sure that um, water consumption it depends on the if you have a kidney problem or is a healthy people. Like if you're talking about someone with like you guys healthy or so today we just mostly I'm talking about the white side, normal individual. So when you look at the Dr. Google about this one, this is the screenshot of the Google. So the US National Academy of Science said 3.7 liter or around 1 liter, I mean 1 gallon. So in the men and in the female, 11.5 cups. Um, the second one is based on the some health expert. They said they call like a rule of eight, 8 cup of 8 ounces per day. The Institute of Medicine recommended 13 cups, like a 3 liters of fluid, and in women 9 cups. Um, but mostly, um, then you guys see the 8 cups. That's something more common that you hear. It's a rule of eight. I don't know who come up with the name of rule of eight, but rule of eight is more common things that I can hear every day that, like many of my patients said, doc, I drink all my eight. I'm trying to make sure that I drink 8 cups of water. So this is the one that I'm gonna ask you guys. If you guys on the floor, somebody said to the patient and you were witness as a student said, hey, you should drink 8 cups of water. Then after said, doc, why you said eight? Why not six? Why not? Who said eight? How did you come up with eight? So I'm gonna just a little bit talk about the those, and then based on that one, this is the screenshot of the um, my wife Instagram that she sent it to me that said, "Hey, look at this. There is a formula even that how much we should drink." And this, I don't know again who come up with this formula that said take your weight divided to its a amount of the ounces that you should drink. So this is all based on the social media and just as a medical student or physician, don't trust fully to whatever that you guys see, and unless there is a study for that. So mostly, as I mentioned, the things that um, is more common, and you guys hear is a 8 glass of 8 ounces water, and they believe it's just if you drink more, you flushed out all the poison, all the stuff in your body. But we wanted to know is there really evidence for this one or not? That if you drink more water, really your GFR increase? If I mean, who said yes? I mean that if I drink more, you think my GFR is gonna be more glomerular filtration rate? Everybody see I see nodding. So that's the general belief. I was thinking the same. That probably it makes sense that when you drink we think that all this water goes to the renal artery and then just flush to the kidney. But someone they did this study. They made I mean, two group, um, 12 young, um, healthy individual, and then they make them in the two group of um, after the some eating some food, they gave them one group low amount of water, one arm more water. And surprisingly, they found the people that drink more water, their GFR was lower. And when they switch again, the same individual, the result was the same. Whoever drink more, the GFR was lower. Um, so that was little bit shocking, or that said, if you want to think that is because it's not really when you drink, it's not going to go to your renal artery. So that was one thing that surprisingly, if you hear that you're attending or said, oh, when you drink more, your GFR is get higher, that's not true. Um, so the other things that this is one, I mean, paper from CJSN, that is one of the highest impact journal in nephrology. And this is the title. My doctor said I should drink a lot and recommendation. But really, when they said drink a lot, two question comes. What's the meaning of lots? Is it gallon, 2 gallon, half a gallon? And then um, what's the what target, what we're aiming for this amount of water? So there are some misconception is in the medical community that in that paper discuss. I'm going to just discuss about three of them. One of the misconception uh, we call like a expanded plasma volume, raise renal function, which increase urine production and therefore facilitate excretion of creatinine and urea. So that's true. But in just one situation, if you're behind, if you're volume deficient, if you have diarrhea, if you have bleeding, if you have some type of volume loss, at that time it's true. So then you expand the volume and then your GFR improve. But in a normal healthy situation right now, when you're sitting here and you don't have diarrhea, nothing, if you drink more, is not the way that you increase your perfusion. The second misconception is the people says the kidney needs a moist environment to work well, and a high urine output indicate a better kidney function. Um, in the first day when I was talking about the urine, if you guys remember the one I drew it here that I said the maximum concentration capability of urine to kidney to concentrate is a like a 1400. So means up to 300 cc urine. That's why I defined the oliguria. With the 300 urine, you're able to dump all the garbage in your body. So therefore, you don't need really 3 liter, 4 liter urine. So that's not the true statement, but this is something that you hear, and as a, we call it, oh yeah, makes sense. When we, if you think that this is the like a room, and if you put more water, is going to be more cleaner. Yes, but it's not the same in the kidney. And the third misconception, um, the people that they have kidney stone, that's the one we said drink more water, drink more water, drink more water. So that's the only um, time that like a nephrology says drink more water or urology said drink more water. But because if I had the kidney stone and somebody told me drink water, and now you come with some kidney problem, you said, oh, my kidney doctor said drink more water, so then you drink too. So in a subset of the kidney stone, yes, drink more water, don't do. But in some other scenario, just think about what you're saying or what your recommendation is. So these are the one. Um, I'm gonna just ask about the when they said what do doctors mean when they said drink plenty of water or plenty of fluid. So then the other things is just what type of fluid I should take. Is water, Coke, Gatorade, or which one is better? Right? So we're gonna talk about a little bit of those. And as I mentioned, these are just I'm gonna trigger your brain to see what you think. So I'm gonna go back to the history. If you look at this one, yeah. If you look at the from the Mesozoic era in the middle, and probably you guys recognize but it's not from the Jurassic time. You guys know this part. From this time, back to the 66 million years ago, when the animal or mammals decided to migrate from water to terrestrial life, um, there was basically they lose the free access to the water. So then, in order to survive, they need to develop new system, new organ to just conserve the water and conserve the salt. So this organ um, basically became kidney. So I'm gonna just go through the like in the 66 million years. When you look at the, do you guys see the cursor here? No. Oh yeah, you see. Yeah, from the time of the um, in the people, I mean in the animals that they live in the fish. If you see here, there is no uh, glomeruli or no Bowman capsule, nothing you see. Is it just tubule? It's very primitive because in the um, sea you don't need really anything to conserve. So the water comes and goes. So whatever you want, you can remove it. So over the years, when this comes through the um, seawater to fresh water, and little by little you see a little bit of this glomeruli started, and then when they come to the land in the pink area of uh, the slide, um, they become loop of Henle develop, and this countercurrent um, system that yesterday we discussed in the small group develop. So this is the main difference for the mammals that lives in the um, land versus living in the sea. Um, that's the one things for the developing of the loop of Henle. So this U-shaped loop of Henle is the most important, and I'm gonna just in the next couple of slides tell you guys what's the um, what they do, what's the structure of this loop of Henle. So this is the one that I'm gonna just emphasize that we have a couple of different size of loop of Henle. One in the overall in human, even in like each one of us, we have the one cortex in the kidney and medulla. So in the 80-90% of the our nephron is sitting on the cortex with a small um, loop of Henle. And some percentages become, they call it, is going to have longer, they call juxtamedullary nephron. Those are the one that make is they have a longer loop of Henle, and it comes down. And when it comes down, that yesterday we discussed the osmolality from like a 300, 400, 5, 6. When they come to the tip of this loop, it's become 1200. So those are the time that you suck the water and just conserve the water. The longer that you have this one, you have more capability to absorb water and survive in the dry situation, I mean, condition. So this is the one that I want to tell you. This is in the cow that they pee more. Oh, sorry. Um, this one, the loop of Henle is not very long, and they urinate, more than half of the things that they drink, they urinate, versus in the some type of rat, um, this is longer, and then really less than 20% of their whatever they drink, they urinate. So you, it depends on the size of the loop of Henle. That's the one. In human, this number is like a 1200. That's the way that we operate. So in the rats, it might be it's 3000 awesome, and the other one is like a 9000. So you realize that whenever that you have a adaptive, if you're living a area with like a desert or something, you have to conserve more fluid. So this is may go up to 9000. So um, the other day that yesterday when we talk about it's not just only loop. We have a ADP um, that help to reabsorb, and we discussed yesterday that is sitting on the collecting duct. But these people, other than collecting duct, they have some of them in proximal tubule. that yesterday we talked that even 60, 70% of water absorption is in um, um, proximal tubule. So now I'm gonna just go to figure out who said 8 glass of water, and is it something that we should recommend people 8 glass of water or not? So there are a couple of stories. In 1945, there was a one paper that suggested 84 ounces of water. And then in 1974, um, a group of nutritionists recommended 6 to 8 glass of water per day is recommended. So these group that they, sorry, I can't see and I forgot I have to use this. Yeah, this group, they said that the amount of water um, that body needs to function is 6 to 8, but really, um, they didn't say that really should be water or anything could be. And then the idea was it's not 6 to 8 water on top of whatever we drink. It's something that um, over time it's became like whatever you do, 6 to 8 cup of water, drink more. So as I here mentioned, it's like a bad game of telephone. So and in many parts of the world, Um, and if you look at this, when the old days, the people go for hunting and they were even no dress or in the sun or something, no one carry those like and then still they were survive and they didn't die. So anyhow, so I'm not against the 8 glass of water, but I'm just gonna say it's not very scientifically. So, but one things that a beverage industry started coming and they said, um, using commercial, sometimes water just is not enough or quench your thirst or some stuff. So, but um, in 1970, a sport drink came to the market. It started with Robert Cate, who developed he was a nephrologist and was friend of the football coach of University of Florida Gator. So apparently during the um, training, some of the football player they just collapse. And then he asked his friend that can you do something? My player, so he came and just get the sweat from those, measure what they lose. Said okay, they lose probably this much sodium, potassium, chloride, and he said I'm gonna replace this one. So he come up with a um, solution that is became Gatorade in future when they an original report of this when he made that Gatorade. Some of the player they said because the taste was so awful, they said I rather collapse and I'm not gonna drink this one. Is so bad. So when they commercialize and then they make it Gatorade, and then when the Gator won the championship, um, the coach of the loser team in the interview said, if we had Gatorade, we could win. Just he became something that having Gatorade is equal to winning championship. So that was his took off and to the market, and the people started using Gatorade. But so this was the one that beverage companies started doing some type of a study, and then the study was imagined that I just keep you guys fast and overnight. And in the morning, I give one group some just water, and the other group just some anything added sugary stuff. And I just ask them do some treadmill or something. And so it's obviously the people that take some more sugar may outperform the other group. So if I just get that one, And I mean, it's obvious, this one. But now I have a data that if you use this one, outperforms the other one. And I can go based on this finding, go started marketing that this is the um, very good scenario. And people like science that they said, okay, yes, this is better. But overall, you know that the design of this study is not very um, well designed or is um, no. After this type of study that they came, mostly sponsored by industry, and Mayo Clinic came with some type of guideline. So now um, scientific community step in. And then after a while, the school guidance in UK came that the people, they should have after every 15 or 20 minutes, they should have break for the rehydration. And I don't know that if you guys have, I mean, you guys young, but like when my kid was young and I had to take them to the school for the soccer or something, first of all, is it just 15 minutes or something, and in a small field, they don't run a lot. And then half of them, they have to basically sit on bench because everybody should play. They don't even sweat. They haven't even done anything. Every 15 minutes, stop. Just drink this to make sure, even indoor. And then this is not my car, but I remember that many times the week that it was our turn to bring some. Uh, that was for the 10 kids, you had to put water, Gatorade, and just to make sure that dehydration not happen. And it's still, um, U.S. military still is the biggest customer of Gatorade. Even in a World Kidney Day, that is um, everybody thinks that okay, so this nephrology society, even one of the in 2015 was a drink a glass of water for your kidney. And the people, that's why they said, okay, even renal society, they said drink more. But um, in a fine print, he said water may protect your kidney, but it won't cure from chronic kidney disease. So is it just okay to drink, but is not over drinking. So after those sport drink um, reached to the one peak and it started coming down the sales or whatever you call it. Now the market said, okay, what else we should replace for that one? And it came as a um, now bottled water. So then, especially if the recommendation was at least drink 8 glass of water per day, and they mentioned you cannot trust your thirst. So So based on this, I'm gonna just a little bit shift the gear and talk about the truth effect. So some stuff that when you wanna just tell, um, if you wanna just transfer some belief, first I have to, if you become familiarized with something at the beginning, and then I repeat it again, it's easier to believe. And then many politician or something, they use us. So there are some example that you heard in the media, like a COVID vaccine. Some group is said is good, some group is said is bad, or eating carrot will help your um, eyes, some other stuff that we use it. And everybody based on this truth effect that I mentioned, they're gonna get tricked, and even doctors gonna have this. So I'm gonna show you guys and the other peer pressure that we get. Watch these 2 minutes.
The gentleman in the elevator now is a candid star. These folks who are entering, the man with the white shirt, the lady with the trench coat, and subsequently one other member of our staff will face the rear. And you'll see this man in the trench coat maintain his individuality, but little by little, he looks at his watch, but he's really making an excuse for turning just a little bit more to the wall. Now we'll try it once again. Here's the candid subject. Here comes the candid camera staff, three of them at least. This man has apparently been in group. Here's a fella with his hat on in the elevator. First, he makes a full turn to the rear, and Charlie closes the door. A moment later, we'll open the door. Everybody's changed positions. See if we can use see if we can use group pressure for some good. Now, in a moment, on Charlie's signal, everybody turns forward. There it is. Notice they take off their hats. And now, do you think we could reverse the procedure? What?
Yeah, this is the impact of the like a group pressure, peer pressure that we see, uh, and this is the one that is a real picture from our dialysis unit. The guy on the right is, as you see, is a very athlete with the amount of muscle or something, and on the left side is one of our dialysis nurses. When I asked the right one, that they said, "Hey, you have a very big, um, but why you take this one?" He said, "The nurses all the time they tell me you didn't drink enough. I don't have any water, so that's why I got this one because I thought I'm a bigger than I have to drink, use bigger one or more one." So this was the real example of the peer pressure. He didn't want to use this one originally, but all the time the nurses said, "Hey, where is your water? Where is your water?" Something, so that he decided to get this one. And this is exactly the one that like you have, like I said, good morning, stop, you're almost made it. And then I was I saw this one in the like a Costco. It was $17 for those, but with the brand of Lululemon was you get $50 for this. And I was thinking that who's gonna pay $50 for the water container with the name of this? And then I saw the one like $108. I said, okay, so then Lululemon is really cheap, is a bargain. So these are the one that we, I mean, use it. You spend money $100 just for the water container, and I really personally don't know that it's just we really need it or not. So I'm just think I have some still time. Um, so what's gonna happen when you drink a lot of this? You reduce the hypertonicity of the medulla, so your kidney not able to reabsorb um, water. So is basically is nothing. You turn to the fish, but your kidney doesn't need any more having this capability to reabsorb because your tonicity you washed out when you use those. Some other things that I'm not going to talk about this one for you guys. And but one things that I can tell you based on this study that I'm not going to go through this one. When you guys drink water, after a while, it's hard to drink, so you don't want it. And this is the really the brain even just somehow stop. Uh, send this inhibitory signal to swallow. But sometimes with the practice, you overrule this type of brain. That's the um, shows this one. And what if we drink more? And what's going to happen? In the first day, I mentioned if you drink more than 6 liters, you pass the capacity, the maximum capacity of diluting urine. So you put yourself at risk for water intoxication. So what is that happen? It's a something that it's a. I mean, these days we see more. I can promise that is observation. You see more hyponatremia, water intoxication these days because people overall drink more compared to like 10 years ago. And then now we had COVID, medication, infection, anytime that cause like some type of SOADH type, you get this water intoxication. The first described case of the water um, intoxication or hyponatremia is back to the 1938. In those days, for the before C-section, cesarean surgery, they would do the tap water enema to prep the colon. So this is the at that time, 1938, they didn't know really about what is the hyponatremia. But the doctor that at that time reported, he just mentioned the first sign after 2 hours of this one was neck pain, and then it started patient vomiting, and then it started having severe headache, tremor, and then eventually convulsion and died. So this is the classic, the best present, I mean, description of the hyponatremia right now. If you tell me that one patient came with the neck pain, then it started having vomiting, nausea, headache, and then coma and died, I said, okay, this patient had hyponatremia. So at that time, they didn't know that they're talking about the hyponatremia, but those tap water that they use um, cause this one. So another tragedy for this one, it was in in 2007 in California, I believe in San Diego, one radio station. It started make it some host for the um, contest they call Hold Your V for V. At that time, this game was very popular. So 18 contestants invited, and then one of them was Jennifer Strange, 28-year-old of mother of three, ended up drinking 2 gallons of water in 1 hour. And Jessica left radio station when was complaining of headache. If you remember the previous one that I showed, neck pain, headache, nausea, vomiting, and then it started having nausea, vomiting, and then seizure, coma, and died at home. Um, so that was the another um, example of the water intoxication and severe hyponatremia. That if you drink big amount of water, and in that case, um, hold themselves to not to pee, is those sign of cerebral edema, and they may die. So drinking too much water is not good. And now these are again real picture that I found from our division. In each one of those uh, cubicle, you see some of the uh, bottle, and even some people they carry even one may not be enough. They did two or three. You see the coffee and the is too much. Even I'm in Arizona, and you know that is in the winter time because the it's one of our colleague had even jackets, hoodies, and even in the winter they carry this one. So who's gonna lose water, or how much insensible loss you have in the winter time, or the other lady the same. Um, and now I saw the commercial that for the travel bag you can have two water bottles. So it's a good market, I think. So just remember for the water, some things that anybody that comes um, with the orthostatic hypotension, with some type of um, HOT syndrome, sympathetic um, dysfunction, autonomic dysfunction, they get dizzy or something. So the recommendation is just drink more water, drink more, keep yourself hydrated. That's absolute right recommendation. But don't say too much. Don't come up because I heard like my nurse practitioners, one of the patients said, I was witness. He said, I drink 2 liters, like half a gallon per day. He said, okay, increase it to three. And I said, you can't say just 2 to 3 when you see is a little petite lady is already. So you have to fix that one. But if you look at the patient like a thin man, then you said, I just give water and fluid the tank, fill the tank, because this is exactly the things that when you come to the floor to the hospital, your attending or your senior resident said, okay, patient he said, fill the tank. But fill the tank means give fluid, not it's not like this. We are human. We have a different compartment in the body and the fluid shifts. So it's not like a fill the tank means 3 liter, 4 liter. Okay, I'm done. I fill the tank. So this one, oh, is working. Let me show you some other things. If I was the coach, I was really fire this one right away. Um, so this was middle of the game, and this goalkeeper was drinking. He said, "Hey, you're a goalie. You don't have even sweat. Why you think that you're thirsty?" And by the time that he was going for the drink water, they scored the other team. So so one other things that the people they said about drinking water, they said, if I drink water, is good for my treating of obesity. Um, is it evidence for that one? Is um, really if we drink more water, is I'm gonna lose weight? So again, one study that they is a retrospective, is an observational study. They found that the people they drink more, they have higher weight compared to the other things. So you can argue that, oh, this is observational, this is the retrospective, it's not this. I get it. So, but in a mass cross-sectional, um, that's the answer is not. But there is a one I found a randomized control trial that they did let me, yeah, this one. If you drink half a liter, 500 cc, like 1 hour before your main food, they found that in the long run, the people that they drink that one, they lose more like a 6 kilo versus 4 kilo. So if you want to use this one, this is the only study that I found. You can use 500 cc before meal. Yes. So this one, the other things that they said, if I drink more is good for your skin. Your skin is, but that's not true. I checked with doctors, I mean dermatologists, and they don't believe that the drinking water make your skin um, better. Uh, but so I'm going to just close it with the one things that I mentioned about this talk so far that I mentioned to you guys about the in a normal individual, like there is no uh, difference between the no fluid, half a 1 liter or 2 liter fluid. I mean, that's their preference. I'm not saying which one is right or which one is wrong. So that's true. But for a normal situation, I would say trust your thirst is the better way. But for the patient with the chronic kidney disease, um, there are many study that how much is it protective or not? Should we give these people more water or not? Is it just like a trend? If our creatinine is 1 and we drink whatever, when the creatinine get worse, the people drink more. So I never said, but majority of the general practitioner or internist, they said, okay, drink more. So that's the trend. I cannot change it. So they drink more, but Um, the data not always support this one, but the one that I was thinking that maybe I should share with you guys, this is the one that they call Rhine trial. In a Rhine trial, um, the recommendation, the finding, the final things is they found is like a U-shaped pattern. If you drink very little, is bad, and if you drink too much, is bad. Something around one and in the middle one, like a 1.5, 2 liters, is a safe one that you can recommend. Don't go and everything in moderation. I believe that's the message I'm gonna give you guys in entire things. Um, if you go with moderation, you're good. Don't put yourself in dehydration and don't make it over. Um, so then, do I need 8 glass of water? Short answer to me is no, but trust your thirst. And as I said, we don't have one size fit all. That's for everybody. It depends to the size, 8 glass of water or not. Okay, I think I'm on time. So if any question or any comments, I'm even from the faculty, if you guys have any comment or question, please. Yeah, yeah. If you're in a some area that is hot, definitely because you have more insensible loss, you have to drink more. Yeah, no doubt. But if you're in a somewhere very cold and you don't have insensible loss in winter, you don't need really uh, because if you drink, the body, the kidneys, you pee out. Um, but as I said, it's I'm not um, against that you're drinking this one, but you pee more. You spend more time in the bathroom. So it's your choice. You know. Okay. So, but please, these are the something that when you go, um, please ask from your um, during your practice, whatever that you hear, especially when you guys go to the clinical things. As a student, mostly maybe you guys observe what they said. Always question. That's it. Why I should give um, why you said 8 glass of water? Why we should give two? Like another good question that you guys hear, the people said follow 2 gram sodium diet. As I said, why 2 gram? Why not 3 gram? Who said 2 gram? Why not 0 gram? Because if it's a sodium is bad for blood pressure, why we don't go with 0 gram? Why? Who said 2 gram? So these are the one that is good to have instead of just listening or many of the people um, these days really they use maybe Google uh, very quickly. Even if I do some run and I ask question on the spot, I get the answer. I said, "Where did you find this one?" I said, "I just Google it." So sometimes the Google may not be real source. Most of the time is good, but always, especially when you want to do practice and the people they come and ask some question that is not on the textbook, like for some reason, I said, "Is coffee good for me?" He said, "Oh God, nobody told me that coffee is good for this disease or not." So you have to come up and then um, you do Google. The patient already Googled it. They knew the answer. They want to test you that what you're saying. So if it's the same, but you really don't know that you're giving them the right information or you just Google and those finding is right or not. Yeah. So thank you. I think it's 9. So see you guys on the small group, right?